Joining us for more on the rise in cases and government interventions and also the happenings in the United Kingdom is Dr. Esien Ukorebi, is a GP and emergency frontline staff on COVID-19, NHS England. Thank you for joining us at this time. Before we come to Nigeria and the situation here in the UK, are we over the peak or witnessing a downward trend in the number of cases there in England?
Thank you very much, Millicent. Currently in the UK, we are experiencing what I believe is a downward trend in terms of the number of deaths as well as the number of new infections in the UK. So yesterday in the UK, we had about 596 deaths in the UK, and that's a significant drop in the numbers that we had last week, this time. So last week we had about 900 people die in the UK, which was one of the highest numbers recorded here in the UK, and it continued to reduce steadily. And yesterday we had just below 600 people die, and we've also seen the number of new infections also reduce significantly, and it shows that we are experiencing a downward trend at the moment, which is very good.
Perhaps in Nigeria, when you compare both cases, one would say, the gap is still there. But when you look at the weakened cases of states, especially Lagos, recording as much as 70, we're witnessing a jump in that. Do you suspect that the more testing is resulting to the more COVID-19 cases, confirmed cases in the country?
Yeah, I believe the more testing is resulting into more COVID-19 cases in the country. And currently, the numbers that we have in Nigeria is not a true reflection of the current situation of the pandemic in the country. At the moment, we have 627 cases of COVID-19 in Nigeria, and we've tested just above 7,000 people. That's just about 10% of all tested cases have come back as being positive. And that means 1 in 10 people have tested positive for COVID-19 in Nigeria, in a population of about 200 million. So I think one significant thing that the government should focus on, which is also WHO's guideline, is testing. We can't test 8,000 people in a population of 200 million and expect to get any kind of trend. In the UK here, at the moment, we are testing about 21,000 people every day. And the plan at the end of the month is to test 100,000 people per day. This way, you can get a trend in the virus. You can know how the virus has spread and the areas that are, the new hotspots of the virus. At this moment in Nigeria, we know that Lagos is the hotspot. And yes, more work needs to be done in Lagos. But apart from the 22 states that have confirmed cases, what is the government doing as regarding to other states that have no cases yet? There might be cases there, but testings have not been done, and we can't know if there are coronavirus patients in those places. So more testing needs to be done in order to get a trend of the virus and help the country combat with this virus, really.
So a lot more work for the NCDC and Presidential Task Force. But the Doctors Association in Nigeria are also worried about a possible trend in hospital transmissions. Has the UK witnessed this, and what was done to curb it, and what measures do you think we need to take to prevent the frontline workers to protecting themselves if we know that COVID-19 presents itself sometimes as asymptomatic?
Right. Currently in the UK, everyone who has come into hospital with a temperature and a new continuous cough is treated as COVID-19 until proven otherwise. So there is a fantastic triage system where those patients who come with a temperature and a new continuous cough are being triaged and they are seen differently from other patients in order to reduce the risk of spreading this virus from one patient to another. Also, it's important and more important for Nigerian doctors as well, to have the appropriate protective equipment, because this would reduce the transmission of the virus from the patient to the doctor and from the doctor to another patient who is negative. So it's important that the government scales up the personal protective equipment for the doctors so that they can confidently look after the patients and also reduce the risk of transmission. And also, I think most hospitals in Nigeria should begin the triage system and to look at every possible case of fever and a new continuous cough as a possible COVID-19 case until proven otherwise.
Tell us about, there are a number of new cases around the world, and a number of people are also getting discharged, and that also is happening in Nigeria. Many people are questioning perhaps the treatment model, because we're also recording a number of deaths, even though we've been told that a number of them, ages 50 to 60, thereabouts, have had underlying causes. What are your thoughts to the treatment of COVID-19 in Nigeria and the UK?
Well, as we all know, at this point, there is no specific vaccine or treatment modality for coronavirus. The mainstay of treatment, I would say, for the virus is symptomatic management. So if people have got temperature, we try to manage their temperature. If they are breathless, they would require oxygen. And if they have significant lung infection, then, you know, in worst case scenarios, they might require ventilators. In the United Kingdom, we treat the same way basically as other parts of the world, controlling the temperature, treating the infections with antibiotics. If there is evidence of bacterial superimpositioning, we also ventilate those who need ventilations. So in Nigeria, I think we should focus on increasing our capacity in terms of oxygen provision in the hospitals, because that's a vital part of the treatment of COVID-19. Because when we see a surge in these cases in Nigeria, then a lot of demand will be placed on the health facilities to provide oxygens, because without oxygens, the lungs will not, function properly in these very severe cases. And unfortunately, we can see quite a lot of people die because of things like lack of oxygen, things like lack of ventilators in the country. In the United Kingdom at this point, the country has a target to get about 30,000 ventilators, which, they are gradually getting up to. I think Nigeria should also consider scaling up its hospital beds, scaling up the oxygen supply to the hospital, as well as scaling up the number of ventilators that are in the country at the moment. Good enough, we have just 21. People have died. That's sad enough, but that's still a low number compared to the United Kingdom that has had 16,000 people, died, unfortunately, over the last couple of weeks, and owing to the kind of health system they have. So there is a scare that if these cases multiplies in Nigeria, then it might be really, really challenging if the health sector is not adequately prepared. So this is the time, for contingency plans to be set up, in the health sector, should this number triple or double in the coming weeks or months ahead.
Finally, and very briefly, going back to the history of the virus, what can you tell us about what many have referred to that this virus has been talked about in books and movies before the outbreak started in Wuhan in December?
What we know from what the World Health Organization has come up with is that, this virus started in the Wuhan province in China, in one of the wet markets where, wet meats are sold. And from these animals, they get transmitted to human beings, and through eating or coming in contact with these animals. And then onwards, they are transmitted via respiratory droplets from one person to another. So what we know is that it's come really from Wuhan in China and from their wet market, against other speculations that, we have been hearing on media that it's from 5G or from a lab or things like that. I think it's rather from the wet market, and it's from the animals transferred to humans.
All right, Dr. Esien Ukorebi, GP, Emergency Frontline Staff and COVID-19, NHS England. Thank you for joining us at this time.
Thank you very much, Millicent.